We're back with board-certified neurologist and Alzheimer's expert, Dr. David Karadier, taking more of your questions about Alzheimer's disease here on Facebook and Twitter. First up is Brooke Elizabeth, and she wants to know, Dr. Karadier, can high blood pressure or diabetes increase my risk of getting Alzheimer's?
You know, it can. They're not specific risk factors per se for Alzheimer's dementia, but anything that increases your risk of vascular event, cardiac events, the studies are showing do increase the risk of dementia. Now, that doesn't necessarily mean you'll develop it sooner, but any sort of risk, high blood pressure, diabetes, cholesterol, obesity, depression, those can all usually show signs of Alzheimer's in patients sooner than later.
Oh, great advice. David Cannon wants to know, is a stroke bad or a fall a factor in the diagnosis?
You know, strokes are usually classified in, what we usually see in those patients are more of what we call a multi-infarct dementia. And they can present similarly to Alzheimer's, but it's a different form of dementia. Again, Alzheimer's is probably about 50 to 80% of all dementias that we diagnose, but there are diagnoses like multi-infarct dementia, Pick's dementia, and other diseases. So a stroke would tend to fall more into the multi-infarct variety of dementia than a pure Alzheimer's disease.
Wow, so there's different causes of dementia. Next up is Sarah, 64. Good question, Sarah. At what stage should someone with the disease stop doing things like operating machinery or a lawnmower?
And that is a great question, Sarah. And I would say the answer to that really should be when family members see a major problem in the patient. And that's why this is one of these conditions that the family members or caregivers are the most important people in helping a doctor diagnose the condition, because they're around the patient most often. In other words, when they see mom is slipping or dad is not doing what they're able to do, that's usually what brings a patient to our attention. And I would say the correct answer to that isn't a specific age or a specific degree of dementia. I would really say when the family starts to see a patient slipping and not being able to be safe doing something like that, that's really when they should stop using heavy machinery, climbing ladders, driving. Driving is a big thing. Just take the keys away. You don't want your family member to hurt themselves or other people.
Wow, that's such good advice. You know, family members, you know, go to your neurologist with your mother or father, or you know, relatives that you think may have Alzheimer's, because neurologists need to talk to you to get very important information that's part of the diagnosis. That's great advice.
Usually, and just to add one other thing, is usually these patients are patients who are in denial. They'll be like, you ask them, what day is it? And they'll be like, I don't know, I don't read the paper. Or what year is it? Or they'll answer with, that's not important to me. So it's really the family that's really helping you and say, no, he used to know this, he was an engineer, he was a mathematician, he should know these answers.
Wow, it's so important. Family members, wow. Sarah, Calamity Jane, 26. If a loved one has Alzheimer's, what do you tell the family?
What I would tell them is to obviously still love your family member and everything, but just be a little bit more careful with them. In other words, don't leave sharp objects out. Make sure if they're turning a stove on, make sure someone's around to check on it. Don't leave them in an area or a situation where if they forget to do something that could put their life in danger. So just be a little bit more careful, a little more caring, still love them, take care of them, and enjoy them.
Wow, good advice. Peyton, 257, how do I tell the grandchildren what's going on? Wow, great question.
I would say that is a very good question. I would say, you know, you bring it up, you want to be honest with them. You want to tell them that grandma or grandpa is a little bit forgetful, not that they don't love you, they're just not being able to remember things like they once did. And I would say you want to try to keep it simple. You don't want to make it sound like you don't want to go through the pathophysiology and try to explain that they have plaques or tangles in their brain. You would say that they're just getting a little bit older, a little bit forgetful. It's very normal, and you just want to be kind of honest with them.
So he's a board-certified neurologist and he's a pediatrician. That's great advice for kids. Keep it simple. Hey, I want to thank Dr. David Karadier, board-certified neurologist and Alzheimer's expert, to answer all your questions here today. If you missed anything on today's show about Alzheimer's, please go to MD-VOD on emPOWERme.tv. That was great stuff. Thank you.
Thank you, John.